Dr. Dhanesh sir, you can carry on.
Thank you, Dr. Nishad. Good evening, good afternoon, and good morning. This is the 1593rd day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Professor Dr. Sanjiv Kumar Singh. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors. We have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. And the second session, that is the international session in English, from 8:30 to 9:30. And from 9:30 to 10:30, we have a local language session in Malayalam. All these sessions are going in a good way. We are very happy to say that we are able to upload the videos of the session on the very next day itself, so that those who miss the session can subscribe the videos without paying a penny and watch it, and you can share it with your friends. And this is all about the International Forum for Promoting Homeopathy. All these sessions are going in a very a good way. We are getting wonderful guests from different parts of the world. Already guests from 65 countries have presented various papers here in this forum, and all the papers were really excellent. And let me come to today's guest. As you all know, it is none other than Professor Dr. Sanjiv Kumar Singh. Sir is the Professor, Department of Repertory at GD Homeopathic Medical College Hospital, Patna. And as person who are lucky to have a connection with Dr. B. Sahani, from where he studied a lot of philosophy as well as clinical part, and he considered himself as a guru for him. And Dr. Sanjiv is a strong follower of classical homeopathy. Besides the clinical activities, he is involved in teaching repertory. After his postgraduate degree in homeopathy, he is a widely traveled person. He's a quite enriching in his brief homeopathy. His social activities as organizer for scientific seminar, workshop, and medical camps are widely appreciated. Dr. Sanjiv Kumar Singh is personally the president of Homeopathic Medical Association of India, Bihar State. He is a research research person. He's also participated in national and international seminars and presented various papers in international forums. Paper presented as internationally on stress management at Kola, Bangladesh in 2001. Paper on homeopathy in the treatment of AIDS and HIV-related cases, and Indian experience at 66th World Homeopathic Congress of LMHA, New Delhi on 3rd December 2011. He has presented poster presentation on effectiveness of rubrics, indications, past history in homeopathic repertory in the treatment of chronic diseases. At 70th World Homeopathy Conference of LMHA, Rio de Janeiro, Brazil, on 27th July 15, and presented papers on significance of past history in homeopathic case study with the repertorial references at 18th All India Homeopathy Congress in 2012 under the auspicious Homeopathic Medical College, a Medical Association of India at Calcutta in 22nd December 2012. Doctor, today presenting a paper on case taking without conversation. That's a very big subject. It's a very interesting subject. Of this is a very important aspect also, because we all know that patients usually come to the clinic and we used to talk what happened to you, what are the things, but here You need not ask anything, but the patient is showing the beauty of his illness in front of you. It is your transformation of that beauty into the clinical picture of a drug. That may be the presenting paper. Okay, anyway, we are happy to have such a wonderful guest in the evening to share the knowledge. Welcome, sir.
Thank you so much. Thank you so much, Dr. Dhanesh sir, for your nice words and introduction about me. And I'm thankful to entire team of IFPH who has given me once again opportunity to share my knowledge, which I have gathered from my guru, Dr. M.K. Sahani and late Dr. B. Sahani and other stalwarts from the homeopathy. So rightly you said, sir, today I'm going to present my paper on case taking without conversation. Uh, can I share my screen, sir?
Yes, sir. Yes, sir.
Okay, sir. Okay, now it is visible, no, sir?
Yes, yes, everything fine, sir. You can make it big screen and
Okay,
okay,
sir.
okay, fine, fine.
Okay, sir. So this is my topic today, and Dr. Dhanesh sir rightly said that we used to face the problems now, and the doctors, especially the newcomers, the students, they used to talk to me that sir, it is very difficult to take the history from the patient and to take the symptoms and convert into the rubrics. But there are so many things in our repertory through which we can take the history without any conversation. If the patient is not in a condition to say anything, in that point, we can it has been upgraded version of the Kent repertory. I can say the synthesis repertory. So many things are there. So let me start the
Sir.
case taking is a unique art of getting into conversation, observation, and collecting information from patient as well as from bystanders to define the patient as a person and the disease. Yes, we all know about the case taking. What is the case taking? And three things I have going to discuss over here in this particular slides, that the sources of symptoms. The sources of symptoms, the first one is the patient himself, second one is the bystanders, and third one is the observation of doctor, observation of yours, which is very, very important. So today's topic, the case taking without conversation, 90% depends on the observation. This should be very improved. Then only we can do the case taking without any conversation. No. So, and this one is not the totality. This is the one aspect which I am going to discuss today. This is the one aspect. On the basis of that, if the patient is not able to tell the symptoms, if I am not able to, I means doctor is not able to take the symptoms from the patient, paucity of symptoms is there. In that conditions, we can rely on this on these symptomatology. And one aspect is that, so on the basis of that, we can go for the totality of the symptoms and we can find out the remedy. The detailed history of the patient becomes basis for a physician to go further into the physical examination and a laboratory investigation in order to define the problem accurately. Yes, rightly it has been said that the detailed history, it's a very important, and on the basis of that only, we go for the further investigation like the laboratory investigation and to prognose the disease, that what is the exactly the person is suffering from. So totality, the detailed history, and totality is very important. And totality consider everything, the mental, physical, pathological, environmental, everything. So the detailed history is very important. Each case is unique in all respects. Only true individualized approach can explore the true picture and help a physician to arrive at a totality in its true sense. So it had been said, Dr. B. Sani, late Dr. B. Sani used to told me, tell me, that you should never think that you have seen such a type of the personality or the patient ever before that, before this. This is like a new universe you are going to enter. So each case is unique in all respect. So you should not be. Our master has also told about no the unprejudiced observation. So we should not think like that, and we should think that this is the unique one which I am going to take right now. Every individual is different in health as well as in disease, and hence every case has to be examined individually, giving importance to its unique expressions during health and disease. This is very important aspect. During the health condition, patient behavior is quite different, and during the disease condition, the same patient's behavior is quite different. So this should be considered very carefully, that what was before and what is after this problem. So this is very important. During the health condition, the patient was very mild, but during the disease condition, patients become irritable. So these are the things which is very important, and we should carefully go through that. Case taking starts as soon as patient enters into the clinic, even without conversation. And as we know, there is two things: the communication. Two types of the communication is there: the verbal communication and non-verbal communication. And it has been said that the 7% is the verbal communication and 93% is the non-verbal communication. So it simply means that the observational part become more important when we are going to do the case taking. So as soon as patient is entering into the chamber of the patient, no, from there we have to start the case taking, and observation is very important. So we cannot say that the patient does not give the symptoms. Yes, it has been already told by many of the doctors and the stalwarts. No, we cannot blame or we cannot say that the patient is not giving the symptoms because they are not trained. But we are as a doctor trained how to take the history, but they don't have any ideas that what doctor is going to ask me. So we cannot blame to the patient that the patient is not giving the symptoms. We are trained, not patient. Suppose patient is in coma, then how to treat without conversation? This is also very challenging things, no? So patient in a position to talk, then it's very okay, very fine. We will take the symptoms, we will convert the symptoms into the rubrics. But if the person is not in a position to talk, at that time the observational part become very important.
Sir,
Especially if
the
you are,
slide is, sir, the slide is
yeah,
not moving. Still the first slide.
first slide,
Yes.
this one.
Yes, we cannot say that the patient does give the symptoms. The same.
Yes, sir.
Yes.
Okay, so we cannot say the patient does not give the symptoms. We cannot say, means doctor cannot say, like so many doctors are coming, especially the newcomers, no, and they say that, sir, a patient is not giving the symptoms. What to do? But we cannot blame to the patient, no, that the patient is not trained. How they are going to seek, and how a doctor will ask, what doctor will ask. But we are trained how we have to take the symptoms, how we have to dig out and take out the symptoms from the patient. So we are trained. This was I was trying to say. We cannot blame to the patient, and especially the patient in coma or in semi coma conditions. So in that positions also patient are not able to talk, no. So the observational part become very important, especially if you are working in rural or tribal area. Tribal people are close to the nature, their lifestyle, food habit, behaviors, everything. So we should consider everything, and they are not so equipped with the so versed with the new advancement and what we have learned. So they don't have idea how to express their problem to the doctors. So in that conditions also we have to observe the way the patient is entering to our clinic. Like now we have the rubrics too polite. So if the patient is coming to our clinic politely and asking, may I come, sir, like this, no. So we have the rubrics for that also. If the patient is coming inside arrogantly, we have the rubrics for that also, like the egotism and other rubrics are there. So from the beginning we have to observe, and we should try to find out what is the normal and what is the abnormal conditions, and that should be considered as a symptoms, and that should be considered as a rubrics. So especially if we are talking about the rural people and tribal people, their lifestyle become very important, their food habit become very important, their behavior become very important. So these are the things which should be considered and which should be pondered over. point to be considered like the appearances. Yes, this is also very important. In general chapter, we have so many rubrics related with the appearances, like the tall, thin. Later on, I will go through that. Then the gestures also. Patient is sitting in front of us, and so many things patients are subconsciously doing, like movement of the hand, movement of the head, face expressions and all everything. So expression and many more from head to foot. So the point should be considered like this, no? The appearances, gestures, expressions, and many more from the from head to the foot. The way patient enters into the clinic, just I have talked about, no, the politely. We have the rubrics for that. Too polite, staphylococcus, one of the important remedy over there. Arrogantly, patient is coming and, like, no, the abruptly patient is coming and cunningly, the way he is entering, and the way he is asking something, no, about the fees and all. So these are the things which should be considered in spite of all these things, that the what is the problem and all, no, aggravation, amelioration, causation. These are the things which we have to consider to complete the symptoms, the elements of the complete symptoms. We have to go through that, but is other than that, these are the things which should be also considered. These are the things which needs interpretation, the way patient is entering, the way patient is sitting, but so many things are there which need not any interpretation. That is not the only one aspect, but one of the aspect which should be incorporated. Yes. Now, this is very important. So many things are there. Like just I was talking about the patient entrance, how the patient, it needs interpretation. It needs hypothecation, no, hypothesis. We think hypothetically that this may be the nature, this may be the this may be the nature, no. But so many things are there. There are no need of any interpretation. Without interpretation, we can write down, we can note down that this is, I can say this is the very strong point of this particular patient, especially the appearances. So one by one, I'm going to talk about that. There is no interpretation, but mental symptoms, especially the mental symptoms, need interpretation. Like starting from the head, just I was talking, no, head to foot, or from top to the bottom, from we can say the mind to the generality. So starting from head, the baldness, there is no problem with the patient, but the who is coming to us, who is coming to our clinic for the treatment of whatever the problem is there, like the headache is there, knee joints pain is there, or abdomen pain is there, but who is having the knee pain, who is having the joints pain, who is having the headache? The person, those who have loss of hair and baldness. This is very important aspect. If the person is not able to give the answer, you can write down. The patient is sitting in front of me, is no having no hair and baldness is there. So I can consider this baldness from top to the bottom. So this is the one aspect which I am going to show you. And so many medicines are there. You can see over there the anacardium, apis mellifica, baryta. These are from the Kent. The K means the Kent, from the Boger. The very authentic sources is there, like the graphitis. Very authentic sources is there. So we can start like this. We can think like this. Similarly, head hair dryness of the hair. Patient is having no problem with that. But you can take this rubrics, because we have to individualize the patient, and we have so many good medicines are there. You can see over here, no, almost many beautiful medicines, and polycrest medicines are included over here, like the thuja, sulfur, medorinum, sorinum. These medicines are involved over here. So here dryness is there. Similarly, the curly hair, there is only one remedy, and that is the megaerium. So, but we have to very careful in this type of the situations also, whether this is because of the style, because of the consciousness of the looking appearance person had made like this, no, or this is the real one. So we have to be very careful also while taking these rubrics. But we have the options. The person is having something else, but the appearance wise, the curly hair, the patient is coming with us skin problem, but the hair is curly. We can think about this. And one another very important aspect is that on the basis of this rubrics, I'm not going to prescribe the medicine, but it should be considered at least 60% coverage of such type of the medicines, which is alone in this rubrics. Now you are yeah, finding over here, Majarium is there. But on the basis of that, I'm not going to prescribe the Majarium. What I am trying to say that Majarium should at least 60% coverage. Then only this rubrics will become very important. A striking feature, no? This is the striking feature. So at least 60% or more than 60% coverage should be there. But this should be considered. This may be considered. We can think like this. Similarly, curly hair becomes Majarium, and be careful. Just I was talking about, be careful with this type of the presentations. Nowadays, so many stylish boys and the girls, they are moving around us. So we have to be very careful. And this is very known face. We all, especially the old people know, we all know about him. Head hair gray becoming a spot in. There is only one remedy, that is the Sorinum. Very rarely we get this, but yes, this is also a very important aspect to individualize the person. So from the head only, we are getting so many things, no, regarding the hair and the presentation of the hair. So this way we can think and we can consider the rubrics. But same thing again, I will say the Sorinum is there, but Sorinum will not be prescription on the basis of only one remedy. There must be coverage of 60 or more than 60%. Similarly, we are coming to the eyes. The glazy appearance, the brilliant appearance of the eyes, you can see over here. And so many medicines are there like the phosphoric acid and opium. This is very important remedy consider. And other remedies are also there which should be considered in our totality of the symptoms. No, so glazy eyes. Similarly, the wild look of the eyes. Patients are having no problem with the eyes, but while conversation, while the case taking, you can see and you can observe and you can write down where in the chapter of the eyes, that top to the bottom, if you are writing, you can write over there the person, the patient which are patient who have sitting in front of me having wild look of the eyes or glazy look of the eyes. And so many medicines are there. In the wild look eyes, you will see the lysinum is there, one of the important remedy over there. So we can think about this, no? Similarly, the winking of the eye. This video was also very famous. Winking of the eyes. Especially the mental symptoms, no? What I was talking about, three things is very important. We all know: conscious mind, subconscious mind, and unconscious mind. Subconsciously, we are doing so many things, and which should be considered as a rubrics, and patients are not aware sometimes, but doctor can observe the subconscious mind by standards. The attendant can observe the subconscious mind. So this winking rubrics, no, we have seen in so many people that they are unknowingly winking their eyes. Very frequently they are winking their eyes, but they are having no problem with the eyes, but they have it is in habit winking the eye. Similarly, repeating the word, we have the rubrics in mind. You will find, no, some what you say, in Hindi we used to say, no, takiya kalam. So used to repeat the same words before the sentence and after the sentence. So for that also we have the rubrics repeating. Similarly, winking the eye, when we will go to the repertory, we used to say blinking, but the rubrics is winking. So winking eye, this is the subconscious mind presentations. So we should be also be very careful about the subconscious mind, because some subconsciously patients are biting the nails, consciously trembling of the leg and all. So many things are there. So this is subconscious mind rubrics, patients winking the eye. Now you can say the you may see the related rubrics with the eyes also, so many. Now the nose, dilated nostrils. We have rubrics for this. Dilated nostril, antim-tarts, spongia is one of the important remedy. Even the phosphorus, one of the very important remedy for the dilated nostrils. The both area, no, this the side is very dilated and prominent. Similarly, the pointed nose. Pointed nose, you can see the pointed nose. We can consider all these things. All the medicines, in pointed nose from the Kent repertory, it has been considered. Similarly, the thick nose is there. Two medicines is there, furamide and calicar, thick nose. So these are the things which need not any interpretation, without any the interpretation, or without putting very the any pressure over your mind. You can write down and you can consider, especially where there is paucity of symptoms. And Kent has also told us, no, that where there is paucity of symptoms, you can start the case with the common and general symptoms. So these are the general and common presentation of the personality. So we should think about this aspect also. And other feature from the nose also, motion wings of fan like motion of the wings, while conversation, while talking, or while even sitting. I have seen so many patient that the nostrils are moving like this, no. So fan like motions. Then the oily nose, we have the rubrics greasy face. Then the picking of the nose, some especially the child, the young children, they have the habit of picking the nose constantly. They are doing that, and in that condition we used to think about the worm in the stomach. So sometimes this rubrics guide also to think about the disease. So we should be very careful, like in this type of the situations. So picking the nose, constant desire to pick the nose, and you can see the sina is one of the important remedy. Only because of this worm conditions, sina is over there. Sulfur is also very important. So the most important things to be observed is the facial expression. We all know the facial expression is very important. On the basis of that, we try to find out especially the what is going inside the patient, what is the feeling of especially the sensation you can get through the face of the patient. So we have so many rubrics related with the expressions also, like the anxious face. Patient is coming to us and having a anxious face. Whatever we are trying to ask, no, the anxiety is there very prominent, and it is getting expressed through the face. So anxious expression, anxious in the face. Then the foolish also, we have the rubrics, foolish expression and foolish behavior also. If both are there, it become very important. And medicine, you can see before, one of the important remedy for the foolish expression and foolish behavior both. And other medicines like the Baraita carb is also there, no. So expression foolish, this is also very important. uh, then the expression frightened, especially in children, we used to get these symptoms. Stramonium, aconite, these are the medicine considered for the fright, which is very important. So expression frightened. And further investigation, like especially the child is coming to us, and you are finding that the frightened face is there. So we used to ask to the parents also, the attendant also, why he or she is looking so afraid. So they said he had some fear of injections, and we are coming to, but we are not giving injection, but we get the symptoms that yes, fear of injection is there. So the pointed fear of pointed object, we can consider the rubrics with this expressions also. We are getting another rubrics with the frightened expressions. So these are the things. Then the face expression, sickly, looking very sick, we can think about this, we can consider these rubrics. So many medicines are there, many more medicines are there. Laches is one of the important, sina, laches, these are very important remedy. Face expression sickly. Then the face expression vacant. Whatever you are talking and finding that the patient is not over here, the vacant. And we used to think about, the absent-minded rubrics. It become very difficult. Though these are the absent-minded, absorbed mind, abstraction of the mind, these are the rubrics, very primary rubrics in our repertory, but hardly we get. And nobody is going to say, doctor, I'm absent-minded. Sometimes we get, but hardly we patient used to say that I'm absent-minded. But this expression, we can think about the absent-minded abstraction of the mind too. So expression vacant, it no, it guide this type of the rubrics guide us to think about the other rubrics also. So expression vacant. Now this is the wrinkled forehead. No need of the interpretation. Before this, there was chances of the interpretation in expression vacant, but wrinkled forehead, there is no interpretation, no need of the interpretation. Directly you can write over there the wrinkled, and especially the this wrinkled one is now the related with the age. So especially the young person, those who are having such type of the things, it become very important. wrinkled forehead, no, wrinkled forehead. And it depends, like we had a movie, Pa. The progeria was considered over there, no? So progeria means the geriatric conditions coming very early to the person and looking like old. So this is very important aspect. If you are getting this type of the things, you can consider and you can think about other problems of the person, that which is related to this age or not. So the healthy, what we have discussed, and what our master has said, the symptoms, regarding the symptoms, our master has said, the any deviation in the health is considered as a symptoms, our master has said. So what does it mean? That first we have to know what is the healthy condition and what is the sick condition. This is the reason behind we start our course with the anatomy and physiology, means the structure, then the function. So we have to know the healthy condition. So if I'm talking about the wrinkled forehead, though, means that at this stage there should not be any wrinkle on the face. But if the person is having, means something is wrong. So this become very important. So this type of the things we should do, and we should think like this. Then only we will reach to the actual problems. So face wrinkled forehead. The facial expressions sometimes need interpretation, but few things which need not interpretation, such as hair growth on the face. Yes, just I was talking that the wrinkle face needs sometimes interpretation, but the growth of the hair on the face, it need not any interpretation. This is very important rubrics which we have considered so many times. And one of the very important medicine, the phosphorus, another one is also there, but phosphorus, the hair growth between eyebrows. And I have remember one doctor from the Uttar Pradesh used to come to Dr. Sahani clinic, Dr. M.K. Sahani clinic. And he used to say that whenever I see this growth of the hair in between the eyebrows, I don't think about anything and I prescribe the phosphorus and patient get cured. But I'm not going to say we should think like this. I have already told no, that at least 60 and more than 60% coverage should be there. That was his personal experience. But these are the things which is very important. This individualize the person. This type of the presentation individualize the persons. All the people are not having like this, no. So this is very important rubrics, and the phosphorus is one of the important remedy for this particular rubrics. Then the face hair, growth of the hair, eyebrows, thick bushy hair, medorinum and sulfur. This is very new rubrics. Uh, uh, this was not in the Kent repertory. It has been taken from the synthesis repertory. Farooq Master and Roger Morrison had the mention these two medicines over there. But we can think about, if the presentation is like that and the coverage of sulfur is very high, then we can think about this rubrics. Coverage of medorinum is very high, then we can think about this rubrics. It is, if it is very prominent at that conditions only. Next one is the face hair growth of hair, women in lips upper. Now you can see, for the male it is very common, it's not a problem, but for a woman it is a problem. And the inclusion of the medicine, you will see corticosteroids, hydrogenium, these two medicine, this is very important, and even the thyroidinum over there. This is also the indication, we all know, indication of the PCOD, PCOS, what we think about, no, like that. So these are the things indicate also, guide also, and this should be considered also. Natramur, for my experience, no, in my clinic, I have seen natramur, one of the important remedy in such type of the presentation. CPI is also over there, Thuja is also over there. But natramur, I have seen so many times in totality also coming. So these are the things which should be considered, and it guide also to think about the disease. What are the problem over there? Why this is there? Then we should think like that. No, so on the basis of that, we can go for the pathological investigations and all. That you should go for the T3, T4, TSH, thyroid regulatory system is properly working or not. So these are the things which guide us. Now, similarly in the mouth, we may see the tongue. Tongue, there are so many presentation of the tongue is there, no, like the cracked tongue, and under the cracked tongue you will see the deep crack, transverse crack, then the lengthwise, so many type of the crack is there. Then the mapped tongue is there, imprint of the teeth over the tongue you will see over there, no, like the indented tongue, we have the rubrics. So we should go for that. Teeth irregular, patient is not going to say anything, they are not having any problem, but while conversation you can observe this, the irregular teeth. There are basilinum and syphilinum, one of the important remedy over there. Then the abdomen distension, children in pot bellied children are there, sanicula is one of the important remedy. So we can think like this, we can observe all these things. Then the skin, dry skin, rough skin, greasy skin, and shining skin. So we have to be very careful. Again, I would like to say, especially with the shining skin and greasy skin, people are using so many cosmetics nowadays, especially in winter, what we are facing over here in Patna, not in the south, but in Patna. So nowadays people are using so many cosmetics. So we have to be very careful. And sometimes without any, patients are coming to us without any cosmetics. So you can see the skins also in this way: dry, rough, greasy, and shiny. Now, this is also very important aspect, the general. I'm coming to top to the bottom now. So the tall people, tall people. Yesterday in my clinic, one lady came to my clinic and she was taller than her husband. Usually it does not happen in our society, but she was really tall. She was around 5'6". So she was a very tall lady, and problem she was having, the hair was falling in a spot. So we consider this tall rubrics also. Tall people in general, we have the rubrics. And one case is there. I'm going to present over here. 21-year-old lady named Kirti Kumari, name is changed, came to my clinic on 9th of December 2020 for the treatment of sterility. She got married around 3 years ago. Her pathological report was showing improper ovulation cycle. Hemoglobin was 9.8 per DL. Husband semen analysis was quite normal with 75% mortality of the sperm. Family history, no abnormality was there. She got married 3 years ago with a painter, belongs to a village. Even having a healthy life and good relationship, she was unable to conceive. The purpose of this case is not to show that what I have done, I have cured the case. The purpose is to show this case is that how I consider the presentation of that particular lady, physically, the appearances and I came to the final remedy. Some mental symptoms I took: fear of thunderstorm. She was very fastidious when she came first time to my clinic. No, she was very up to date. No, even we call it, no, the Banarsi sari and lipstick and everything was there on the face. Company desire for. So this is the reason behind that I took the rubrics fastidious, and another rubrics also I took vanity. Vanity. She was uh, covered by the cosmetics and all, so many things, the lip liner and makeup and everything. So, and color red desire was there. These are the rubrics which I had considered at that time. Mind colors, red desire for, company desire for, fastidious, fear of thunderstorm, vanity, head lice, stomach vomiting, riding in a carriage aggravate. She used to vomit while traveling in bus or car. Female genitalia, sterility was there, and food and drinks, pungent desire. So in short, I am presenting the case over here. And I got the medicine, you can see over here, no? Out of 9, sulfur covered 8, and phosphorus covered 7, arsenic covered 7. So the first remedy was the sulfur. On the basis of totality, at that time, I prescribed sulfur on the basis of the totality. On 12th January, she reported with no change, prescribed sulfur 0/2. 20th February 2020, she came back with no change, and as usual, menses was normal. Transmitted, just I talk, no, let me describe that. I said transmitted because I also practice the same thing which Dr. M.K. Sahni is doing, and which was invented by Dr. B. Sahni, late Dr. B. Sahni, transmitting the medicine through the hair. and we are using LM potency, especially for this transmission. So since beginning, I'm doing this. So I transmitted this sulfur 0/2 on 20th February 2020. She came back with no change, and as usual, menses was normal. Everything was same. All the symptoms, what I had taken and considered for the reporterization. So everything was same when she reported. Just I was thinking where I am wrong. Suddenly I realized that a mistake which was committed by me should not be, that should be considered at first the physical appearance. She was tall and lean. Uh, it- One aspect, but is very important. With all other presentation, this should be also considered. She was very tall. She was taller than her husband. She was taller than her brother, even taller than her father. It was like that. And she was lean and thin also. So I considered two rubrics, tall people from the general and lean people from the general. Now you can see the reporterization chart. I added these two rubrics, lean people from the general and tall people from the general. Now the choice of medicine remedy is become phosphorus. Degree wise also, degrees on the basis of gradation of the remedy. So degree wise also, and on the basis of totality. And sulfur is also covering the 9. But sulfur already we had prescribed with no any changes, no any result. So I consider this phosphorus after the sulfur. So on 20th February 2020, I transmitted phosphorus 0/3. Again, you can see, you can ask the question that why you consider this 0/3 after 0/2. So there are some things, like if you have prescribed 30, so more than that, like the 31 should be prescribed to uh, discard the changes had been made by the 30. So I think like this over here, and increase the potency of the phosphorus because it was in the totality. So as antidote also you may think, as totality also you may think. So I transmitted phosphorus 0/3 on 19th March 2020. She came to report her hemoglobin improved to 12.7 from 9.8. And important information she gave that menses delayed by 3 days. I asked her to do the pregnancy test after 10 days. On 1st of April, she reported her pregnancy report came positive. Treatment continued at that time. So this is the lean people. Rubrics is there. Obesity. So similarly, and she got cured. She pregnancy, she conceived and finally she delivered a child. So these are the things which should be considered if we are not getting the result. And the presentation, like what we have discussed today. So it should be considered over there. Lean people, then the obesity, the person, whatever the problem is there. But if the person is coming with like this, we should consider this. So conclusion is that there are not these are not the only aspect to decide the medicine. These are one of the important aspect which should be considered. To whom we are going to treat, whether he or she is tall, obese, having thick eyebrows, rough skin, and so on. So many things are there, no? So which should be considered. The person who is having the pain in the joints or asthma, or how he or she looks, the appearances, these information must be incorporated because these are the component of the constitution of the patients. Thank you so much.
Thank you, Professor Dr. Sanjiv Kumar sir. It's really an excellent session. You really show the beauty of case taking in the shortest possible time by observation, as well as connecting things together to find the right remedy, even without asking the patient some questions in that respect. Anyway, it is the time for discussion, and those who want to join the discussion can raise your hand so that we can have a discussion, as well as you can we can have a question and answer session or two. I think Sahani sir is there. Yes, Sahani sir.
I don't think Sahani sir is over there.
Yes, sir was there. A little bit. Yes. Tariq
Sir,
Subek. Yes.
sir, thank you, sir, giving me a chance to ask question. Sir, if these are the part of a personality, should these not be included in daily practice, or only then be taken when the simillimum does not work? Because at the end of his lecture, this sir said that you should take these aspects only when one the simillimum fails. Just for my curiosity, to satisfy my curiosity, sir. Thank you.
Yes, sir. No, what I said, no, this is the one aspect. This should be considered and this should not be also considered. But what I said, no, like we have gone through one rubrics now. The curly hair, Majarium was the medicine. The only one remedy was there over. But if I am getting the 60% or more than 60%, if you have taken altogether 10 rubrics and Majarium is already over there with the 60% coverage, means the 6 rubrics has been covered by the Majarium, and you are getting this curly hair, this become very important. So on the basis of that, if you are going now to prescribe the medicine, the chances of cure is very high. What I have experienced in my practice. So what I told, this is the one aspect, and especially where there is the positive symptoms, you are not getting the symptoms, become very important. It become very important. But if you are getting the actual totality through the patient, like the will, emotion, intellect, and conscious, subconscious, and unconscious. So through all these things, if you are getting the totality, then it's very okay. But if you are not getting, then these aspects should be considered over there.
Okay.
What I feel that importance of the single rubrics, that is also there. We have to know that what is the importance of the single rubrics. You're getting me what I am telling?
Yes, sir.
Are you able to listen?
Yes,
Yes,
sir.
sir.
Yeah. So importance of the single rubrics, that it is said that sometimes they are so prominent that they can be used as an eliminating rubrics. And this was also told by Dr. Bonigesens also. Eliminating rubrics is important when you feel that they cannot be changed, that things are very stable in nature. So in this way, this type of the rubrics, what Dr. Sanjiv was telling, is quite okay and important. So eliminating process and these aspects are there. That's why when he says that if it is present in this one rubric and not present in 3 or 4 rubrics, then in that case also it can be applied. This I feel.
Yes, sir.
Yes, sir. While repetition, the case you presented here, you
Yes.
just went with the observatory part. That means just ignore the small lead aspect, but instead you went with the other thing. That's the reason why the sulfur came. But usually, while after repetition, it is told we used to say that when you get such remedies, even though you get a remedy which is having high mark, you can even eliminate that remedy because the other things are when the temperament of the patient is need to be looked into to avoid to find the right remedy.
Yes, sir.
In this respect also, we can say that means that if a medicine is having high grade of marks in repetition, need not be given to a patient. But some people used to do to rare remedies also in those situations, particularly constantly in the world, which is rare in the patient. We may not be able to find such symptom in any other patient sometimes, but only sometimes 1 in 100 or 1 in 1,000 like that.
Yes, sir. Yes, sir.
Yes, sir.
No, so
That one case I can tell you, just 2 days before, my son was having a lot of cough. And we found that constitutionally where he was the calcareata, and that it was there. But the important rubrics that I got, he told me that he's also doctor. that after every cough is followed by the eructations. So there is one single remedy, lobelia. When we read the lobelia, I found that it is pneumogastric presentations is the prominent part, pneumogastric, and he had a lot of the flatulence and gastric problems. And we used lobelia in 0.3 potency, and he now within one day, the more than 75% of the cough is gone. So, and this is what you say, that sometimes obstacle is being created. In that case, rare remedy used to help. Now here the lobelia is working as a rare. It may not be the rare remedy, but here it is working like a rare remedy. So this rare remedy are used, can be used also as removing the obstacles that has been created, and thereafter it may be paving the path for the other constitutional medicines that was there. This is the things that has been told by Dr. Hahnemann also in his different places.
Thank you, sir. Thank you, sir.
Hello.
Dr. Harihan, sir, you can.
Hello, Dr. Sanjiv.
Yes, sir.
Your observation is very correct.
Thank you, sir.
So I really appreciating you.
Thank you so much, sir.
Really appreciating you. But see, this single rubric method sometimes do very sharp shooting in my experience. That
Yes,
I
sir.
have seen that. I have seen that, and I have experienced that also. See, in neuropathy, there is a lot of single rubric and single medicine is there.
Yes, sir.
Neuropathy.
Yes,
See,
sir. Yes,
that
sir.
is clinic. I think that is clinically verified remedies.
Yes, sir.
Sir, I don't say that it may be the clinically verified, because sometimes you might have heard about the mutation of the symptoms. Sometimes in the observations that are there listed in the Mitra Medica are only based on the observations. The person who has observed these things, he might have seen that this is and no other remedy. So what I feel about the rare remedy is that it should at least go to the basic, like that I told you about the lobelia. In the new that needs to be considered first. So the rare remedy and has got its utility unless and because Bonifacius has already remarked that patient is never represented by a single symptom, however peculiar it is. One of the beautiful line by Bonifacius. Patient is never indicated by however peculiar it may be.
Maybe.
So in this aspect, I can only say that these aspects are the mutated type of the symptoms, and that need to be removed by just as an intercurrent medicines, and it can be used. Maybe I don't say can be, but it may be used like that.
One question is there, sir. If obesity is due to any underlying disease like hypothyroidism, we should consider the obesity or not? Yes, definitely we should consider. This is the manifestation, no? So manifestations always give a gate to enter into the patient. So definitely we will consider the obesity.
In this aspect also, where we have to find out the relations, because relationship between the obesity and the thyroid relations. That only will work like in a beautiful way.
Yeah, that will there. But definitely we will consider. No, this is the presentation. This is the manifestation, and what we are taking during the case is the symptoms. So symptoms is the manifestation of derangement of the disease. So definitely we should think about the obesity in case of the hypothyroidism or whatever the problem is there.
Sir, one of my doubt is that any susceptibility regarding this physical constitution. Suppose a patient is coming to us at lean, thin, see appearance of, see it that patient may be susceptible to tuberculosis. In such a way, what is your opinion regarding that?
No, definitely susceptibility, but that is the secondary aspect. No, the first we are thinking about the appearance. First, we are thinking about the way patient is entering to us, and that will be the entry point. That will be the entry point, like the lean and thin people. After that, we will think about whether the patient is allergic, whether the patient is tubercular. No, so on the basis of that, the second thought will be created. What you are saying. So definitely, we will think about the susceptibility and tubercular diathesis also. But the first thing is that the lean people is very important for us. That will be the entry point.
Okay, good.
Sir, in this case itself, sir has shown that after giving phosphorus, the hemoglobin level suddenly
Increased.
increased in such a level.
Yes, sir.
Normal level. That's something great. Even we giving any tonic or any iron compound. That is the beauty of homeopathy.
Doctor, see, certain constitutions are prone to certain diseases.
Yes, sir. And one question is also there: if the patient is in ICU by the sedation of allopathic medicines, definitely if the patient is in coma in ICU, you have to see the movement of the hands, you have to see the eyes, you have to see the tongue, the skin. You can see whether it is rough, oily, and so many things are there. No, but these are, if we are talking about allopathic on the base dependent on the allopathic medicine, so we have to very careful that is not the actual presentation of the patient. So in this type of the situations, the second source of the symptoms, which is the bystanders, which is the attendant on the we should rely on him, and we should ask what is the characteristic feature of this particular patient. So on the basis of that, but sometimes we get so many things like, no, the ticks, the jerks. Patients are admitted in ICU, and we have the rubrics like the jerks, ticks, so many things are there. Eyes are slide open during sleep, or while the patient is in ICU and coma. So on the basis of that, you can think about so many things are there to observe.
Sir, this is only a part of constitution, sir. Again,
yes,
we can go through the talking, see step, how he walks,
yes, sir. Yes, sir.
movement of lips.
Yes, sir.
These are all we can consider. These are our points, and see we must dig out it from our repertory.
So when we think of,
Yes,
when
sir.
we talk about the constitution, sir,
I have already told this is the one aspect, sir. This is the one aspect
Only,
which should be incorporated.
As only we have only 1 hour, that is the reason why sir has presented only that much of thing.
Yes,
Since definitely we need more sessions on this, so that we can have a better study on all these things in the coming days, sir. Because this kind of process,
sir, sure.
Dr. Indrani has raised hand so that you can speak, Doctor. Please unmute yourself. Please unmute.
Thank you, sir,
Yes.
for allowing me. Yeah, sir,
Yes.
here I am Dr. Bhavdekar from Pune. Here, many times I see a patient for a second call as a homeopathy in ICU. But like you rightly mentioned, see, the patient is in comatose, cold extremities, half eye open. These are all effects of sedation. So how should we collect the information? That is the main problem. No physical generals and no observation. So how to proceed? It's a very big problem for us. So how can you guide us from the non-verbal communications? How to collect them?
so even during the sedation, the patients are sedated. In that case also, whatever the presentation during the coma or the patient in the ICU, they are very natural. And that natural is dependent on the basic constitutional pattern of the individual. And that reflects the individual. So they had to, because there are many evidences. I have seen such type of the patient. We were used to visit the ICU patients in our hospital also here in Patna. And there we have utilized these informations very beautifully. And it has, like, suppose a patient is very unconscious, and some part of being unconscious doesn't mean that he is dead. Some part there must be the motion, and this is the motion. Which part is which has got the sensation? That is important, and that reflects the individuality, better individuality of that person. I remember a patient who was unconscious and was lying in the bed, and the foot toes were moving, slightly it was moving. And that movement of restlessness of the toes, even during the unconsciousness, Ginkgo metallicum was the medicines, and it worked wonderfully with the patient. So,
Thank you, sir.
yeah.
Thank you, sir. Thank you. Yeah.
It is the time to wind up the session. Dr. Indrani Bhadwardkar, you can say the vote of thanks to the session also. And Dr. Indran, you can say the vote of thanks to the session. Are you listening? Okay. Also, it's Dr. Harian, sir. You can say the vote of thanks to the session.
Hariharan will be the right person to say vote of thanks.
Sir, see, last time, see, I think there is no response and the patient is conscious. In such cases, why can't we think about opium, sir?
Maybe it may be it is like that, but your overall presentation, opium can also be thought of. There are many things that need to be because it is not only that one observation, the patient can be seen in a different angles also.
Okay, sir. Okay, sir. Thank you. On behalf of IFPH office parents and the parts of see all the hearing doctors and lovers, on behalf of these persons, I like to congratulate Dr. Sanjeev, and thank you very much, sir. Sir, please come to our this IFPH platform again with some other topics.
Definitely, sir.
Okay.
Definitely.
Thank you very much, sir.
Thank you so much, sir. Thank you so much, sir.
Okay.
Thank you, Harihan, sir, and Dr. Sanjiv Kumar
Thank you so much, sir.
Singh, sir, and Sahani, sir, and due to us in the session. Tomorrow we will have a session from Dr. BONO Prakash, who is a neurosurgeon from Bangalore, who is very much interested in holistic science, and particularly promoting the and all other eye systems, and a man he will be talking about human mind evolution. Tomorrow at the same time, hope all of you will join us in the. You can also join by using the same link you used today. Thank you all.
Thank you so much, sir.
Thank you, Sanjeev Kumar, sir. So over to Dr. Maria John to moderate the Malayalam session.